Hey there everyone, in the previous video we had studied the lumbosacral plexus and we completed the front of the thigh chapter. In this video we are going to start a new chapter, that is the medial side of thigh. So this video is going to cover the introductory part of the medial side of the thigh. We are going to see the important contents, the boundaries and the peculiarities of the medial side of the thigh muscles. So let's get started. So the medial side of the thigh, it is also called as the adductor compartment. Okay, as we know, the front of the thigh, it is called as the anterior compartment or the femoral compartment, or the extensor compartment. So this medial side, it is called as the adductor compartment. Okay, so the medial compartment of the thigh lies between the anterior and the posterior compartment of thigh. Okay, as we all know that if this is the thigh, okay, so this is the anterior compartment, behind this lies the posterior compartment. So the medial compartment lies in between the anterior and the posterior compartment. Okay, so this is the medial compartment that lies between the anterior and the posterior compartment of thigh. It is well developed. Okay, this part of the thigh, it is well developed than the rest. Okay, its compartment, its counterpart in the arm is the coracobrachialis muscle. Okay, it is the coracobrachialis muscle, just remember that. Okay, now what are the boundaries? Okay, let's see the boundaries. So as we all know, this is the anterior compartment, this is the medial compartment and the posterior compartment of the thigh when you take a transverse section. Okay, so see, it has walls, okay, or the intermuscular septums. So there are 3 intermuscular septums. Alright, so this is the medial intermuscular septum, posterior intermuscular septum and the lateral intermuscular septum. Okay, just remember that the posterior intermuscular septum, it is ill defined. Now how to remember which intermuscular septum is dividing what compartment? So we had already studied this intermuscular septum in the first chapter, introductory part. So make sure to check out that video if you haven't yet seen. So see, there are 3 intermuscular septum, that is the lateral intermuscular septum, posterior intermuscular septum and the medial intermuscular septum. So lateral, posterior and medium. So the posterior, it separates the posterior compartment and the medial compartment. How do you remember? P for posterior and P for posterior compartment and the medial compartment, PM. Okay, P for posterior and P for PM. So the posterior compartment, it separates the posterior and the medial compartment. Okay, the medial intermuscular septum, okay, it separates the AM. So if one is PM, then the other one should be AM. So okay, it is the medial compartment that separates the AM, that is the anterior compartment and the medial compartment of the thigh, and the last one that is left is the lateral AP. Okay, it which one is left, that will separate that compartment. So it will separate the anterior and the posterior compartment. See here, the posterior intermuscular septum, it is separating what? PM. Right, P for posterior, P for PM, posterior and medial compartment it is separating. So this is the posterior intermuscular septum, and the medial, it is separating the AM. So that is the anterior compartment and the medial compartment. So this is the medial intermuscular septum, and the lateral one is the last, whichever is left. So see, it is separating the AP, that is the anterior and the posterior compartment of the thigh. Okay, so these are the boundaries. Now we're going to see what are the contents. Okay, see, it contains of muscles, nerves and arteries, of course. Okay, so see, the muscles are 6 muscles. The medial side of the thigh, it contains 6 muscles, okay, which are divided into intrinsic muscles and the extrinsic muscles. Okay, so there are 5 intrinsic muscles and only 1 extrinsic muscle. Okay, how do you remember this? It is very easy, it is in the name itself, the obturator externus. Okay, the obturator externus. The intrinsic muscle, it is the adductor longus, adductor magnus, adductor brevis, gracilis and pectineus. All this, the origin, the insertion, nerve supply, action, we're going to study in the next video. Okay, so this is just the introductory part. So these are the intrinsic muscles, and the obturator externus, this is the extrinsic muscle. So this is about the muscles. And the nerves, there are 2 important nerves. One is the obturator nerve. Okay, just remember that the common nerve that supplies all the muscles of the medial compartment of the thigh is the obturator nerve, okay, the obturator nerve, okay, and the accessory obturator nerve. The thing about accessory obturator nerve is that it is present only in 30% of the subjects, and it is not present in the rest of the people, okay. It may be present or it may not be present, but the obturator nerve, it is always present, okay, of course. But the accessory obturator nerve, it may be present, may not be present. Now about the arteries, okay. The arteries, there are two arteries, of course, obturator artery and the medial circumflex femoral artery, okay, the medial circumflex femoral artery. We are studying the medial compartment, so of course the medial circumflex femoral artery is the artery that supplies the medial compartment of thigh. So now what are the peculiarities of the adductor muscles of the or the medial side of the thigh muscles? What are the peculiarities? Okay, all the muscles are supplied by the obturator nerve, okay, all the muscles, they are supplied by the obturator nerve, okay. What are composite or hybrid muscles? The composite muscles, you can also call them as the hybrid muscles, okay. They are supplied by two nerves. The muscles which have two nerve supplies are known as the composite muscles, okay, or they have a dual innervations of nerves, okay. See, so the composite muscles in the medial compartment of the thigh are the pectineus muscle and the adductor magnus muscle, okay. How do you remember that? PAM, okay, just remember that, pectineus muscle and adductor magnus muscle, because there are two more adductors, that are the adductor longus and adductor brevis muscle. So the pectineus and the adductor magnus. So obturator nerve and obturator nerve, it is common, and the femoral nerve supplies the pectineus muscle, and the sciatic nerve, the tibial part of the sciatic nerve, it supplies the adductor magnus muscle, okay. So the femoral nerve, it supplies the front of thigh as well, and it also supplies the pectineus muscle, okay. The adductor magnus is the muscle of the medial side, and also considered as a muscle of the posterior compartment of thigh. So it is the adductor magnus. So the sciatic nerve, it supplies the posterior compartment, since the adductor magnus has it supplies it is present in the posterior, and the medial, it is by the sciatic nerve of the posterior compartment. So just remember that the composite muscles are the pectineus muscle and the adductor magnus muscle, okay, PAM, okay. Now the rider's bone. What is rider's bone? See, in horse or riders, the round tendons of adductor longus, which muscle? The adductor longus muscle gets calcified due to friction with the horseback. So this condition is called as the rider's bone. This is not the clinical anatomy, but this is given in the peculiarity section in the chapter, okay. So it is the what is rider's bone? In the horseback riders, the round tendons, okay, the round tendons of the which muscle? The adductor longus muscle, the adductor longus muscle, okay. Just remember that. How do you remember it? I don't know, I'm just I remember it this way. So for riding the horse, a person should be taller, okay. The person shouldn't, if a person is very short, he cannot climb in the horse. So just remember that for riding the horse, a person has to be tall. So which muscle is it? The adductor longus muscle. You have to be tall, you have to be long. So the adductor longus muscle, it gets calcified due to the friction with the horseback, and this is called as the rider's bone, okay. This is the peculiarity, I don't know. And now these muscles, the adductor compartment of the thigh muscles or the adductor muscles, they are called as the custodian of virginity muscles, okay. It the name to these muscles, it is given this way, okay. So the custodius virginatis, I don't know how do you actually pronounce it, but yeah, it is. Now the gracilis muscle is the most superficial muscle, okay. They ask you which is the most superficial muscle in the medial compartment. It is the gracilis muscle, okay. It is the gracilis muscle. The gracilis muscle is the most superficial muscle, okay. So when you go to the park, you see there is grass, and also it is superficial, of course, the sand or the stones, or whatever, it is lying deep. So what is superficial is the grass. So just remember, it is the gracilis muscle, that is the most superficial muscle, okay. So the muscle is used in muscle transplantation because it is superficial, easy to be taken out, or like that. And reconstructive surgeries, it is used in reconstructive surgeries, that is the external anal sphincter, okay. For transplanting that muscle, we use which muscle? We use the gracilis muscle, okay. It is the most superficial muscle, and it is used in muscle transplantation and reconstructive surgeries, okay. This is one of the peculiarity of the gracilis muscle. Okay, now what is the important, this one is important, okay, you have to remember this. Okay, so what is the osteoaponeurotic gap? What is the osteoaponeurotic gap? It is present, this gap is present between the adductor magnus muscle and the shaft of femoris, okay, which is the osteoaponeurotic. How do you remember? It is the adductor magnus, just remember AM, okay, Aisha moment. Okay, who taught you this chapter? Aisha moment, you saw Aisha moment's lecture. So the adductor magnus, for the aponeurotic gap, it is between the adductor magnus and the shaft of the humerus. Okay, the gap, see if this is the adductor magnus muscle and if this is the shaft of humerus. So this region whatever you see here, this will be called as the osteoaponeurotic gap. So it will be called as the osteoaponeurotic gap. Okay, what does it do? It provides passage, it provides passage to femoral vessels, femoral artery, femoral vein, and okay, it provides passage. Okay, this area, whatever, from this, okay, from this region, it is providing passage for the femoral vessels, the femoral vein, and the femoral artery. Okay, they are passing through the aponeurotic gap formed by the adductor magnus muscle, and between the shaft of the humerus and the adductor magnus muscle. Okay, so okay, it also forms the adductor canal, okay, into the popliteal fossa. Okay, it extends from the adductor canal to the popliteal fossa. So the adductor canal, we know that it is formed by the base of the femoral triangle. Okay, so this is the adductor canal. From the adductor canal to the popliteal fossa, it extends from the adductor canal to the popliteal fossa. So this is the humerus. Let me actually draw it nicely and show you guys. Okay, so suppose this is the popliteal fossa and this is the adductor canal, and okay, so this is the muscle. So this is the adductor magnus muscle, and this is the bone of the femur. Okay, this is the bone of the femur. So this is the the popliteal fossa. So it is giving passage to femoral vein, and it is giving passage to the femoral artery. Okay, the femoral artery at this place, the popliteal fossa, continues as the popliteal artery. Okay, we have already studied that, but listen, so this is the aponeurotic gap, and it extends from the the adductor canal, extends from the adductor canal and to the popliteal fossa. So this portion is called as the aponeurotic gap, osteoaponeurotic gap, contains the femoral vein and the femoral artery. Okay, so upper and profunda femoris artery and superior adductor compartment. Okay, see the adductor canal. Okay, this is the adductor canal, upper and osteoaponeurotic passage. It is the upper and osteoaponeurotic passage of the adductor canal, as we saw, and it contains the profunda femoris artery as well, the branch of the femoral artery, that is the profunda femoral artery, which supplies the adductor compartment. It supplies the adductor compartment. Okay, the profunda femoris artery, it supplies the adductor compartment, and the femoral artery, which muscle does it supply? The femoral artery. In the composite muscles, which muscle does it supply? We saw two composite muscles, right? Okay, so the femoral artery supplies one of the hybrid muscles, that is the pectineus muscle. Okay, that is the pectineus muscle, and the tibial part of the sciatic nerve supplies the adductor magnus muscle. Okay, thank you so much. This was the introduction, and in the next chapter we are going to study the origin, insertion, nerve supply, and the action of the medial side of the thigh muscles. Okay, thank you.